My name is John Oliver, and this is my internship oral presentation for SPES460. I interned at Salina Ortho and Salina Regional Health Center's outpatient physical therapy clinics. The top picture shows the main entrance to Salina Ortho, and the bottom picture shows the Salina Medical Arts Building, where the Salina Regional Outpatient PT Clinic was located on the top floor. I learned about the internship through my academic advisor, whose wife works at Salina Ortho. Salina Regional Health Center was found out to me by a mutual friend who had shadowed with the PT that I shadowed with previously. The application process included a lot of paperwork. This included medical procedures, immunization records, and basically any information that they would need for an intern to succeed in their clinic. Email was the primary form of communication, specifically with the PT at Salina Regional. Email was our best form of communication, and I primarily went through my advisor's wife at Salina Ortho for my contact. The topic of my internship was physical therapy, which is a health profession that uses exercise prescription and other modalities to treat chronic and acute conditions in the body. Last summer, I worked as a physical therapist aide in Highlands Ranch, Colorado, where I gained over 200 hours of experience working in an outpatient clinic multiple times a week. During this internship, or job, I guess you could say, I helped patients run through their entire workout programs. I stretched them out. I got them ice. I basically did everything to help make the clinic run as smooth as possible, being an aide. With that experience, this really excited me for a new opportunity to where I could demonstrate those skills in a new setting. I was interested in this opportunity because it gave me a chance to observe in a different state, first and foremost, as well as get me out of my comfort zone. This was going to be a new area of PTs and other health professionals who I'd never met before, so it was important for me to take a step out a little bit and see a new place. I first began my internship at Salina Ortho, and this internship lasted 5 weeks. I primarily worked with physical therapist Steve Shogren, who was a Bethany graduate and ultimately earned his PT degree from Wichita State University. Salina Ortho is located off of Santa Fe Avenue, just down the street from campus, and is a primary place that a lot of our athletes go to for their rehab if they've succumbed to an injury. The wonderful thing about Salina Ortho was I got to observe in multiple different settings. I spent about 75% of my time during my internship in the outpatient PT clinic in their main building. During this part of the internship, I primarily helped the PTs get equipment for patients, hooked the patients up to e-stim, got the patients ice bags, helped stretch patients out. I basically did everything I could to help and make the clinic run as smoothly as possible. A phenomenal opportunity that I got to experience while I was at Salina Ortho was getting to be in the operating room. This was done at Salina Surgical Hospital, which is just a couple buildings down from Salina Ortho off Santa Fe. Here at the Salina Surgical Hospital, I got to actually be in the operating room and watch surgeries be performed by the same doctors that worked at Salina Ortho. In the operating room, I got to watch total knee replacements, total hip replacements, a reverse shoulder, a toe amputation, a carpal tunnel release, and a trapezius removal of the bone in the hand. So I was able to see a wide variety of surgeries, which greatly interested me and allowed me to see the same anatomy that I was seeing in textbooks in a real life setting. I was also able to sit in with an MRI technician for a day. I have had MRIs performed on me, but this was the first time where I got to sit behind the scenes and see how the MRI machine was operated. Here I learned how to read MRI sonograms that come off, and just basically got to learn more about the importance of MRIs and how much they can tell us. I also got to walk around with a physician and his physician's assistant. During this experience, I got to go into multiple patient rooms and just sit in on the questions that the physician and the physician's assistant were asking to the patients. This varied from moving a patient onto physical therapy, or discharging a patient completely, or even giving them a briefing on a new procedure that they were going to have done on them. So it was great getting to see a full experience of everything and everybody who works in the healthcare field. During my time off, I would lounge in the office with the PTs and PTAs and basically just pick their brains. They were very, very kind and willing to answer any questions I had regarding the profession, which was awesome. These are some pictures from Salina Ortho. The first picture on your left depicts kind of their machine row, where they had 3 recumbent bikes, a step machine, and a treadmill. The second picture shows the east side of the gym with a couple of treatment tables just down the way from the treadmill, as well as a wall where they could keep all their strap weights. The third picture shows the office space for the PTs. Each PT had their own little office space where they could get any kind of paperwork done, and each office space had its own computer built into it. The fourth picture shows the main area of the gym. Along the west side, there were 4 treatment tables where basically I got to spend a lot of time just hanging with the PTs and getting to talk with them and the patients. After my 5 weeks was completed at Salina Ortho, I then hopped over to Salina Regional Health Center, where I was at this clinic for 2 weeks. I worked with physical therapist Denise Justice, and the funny thing about Salina Regional is that it is right across the street from Salina Ortho. And when I say right across the street, I mean right across the street. They are directly across the street from each other off Santa Fe, just down the way. While I was here at Salina Regional, I specifically observed in their outpatient physical therapy clinic. While I was there, I got to experience multiple things in a new clinic. This clinic was by far the biggest clinic I had ever been in. It was huge, with a huge gym area. They had their own patient rooms for evaluations, and there was still more space that is yet to be expanded for them in the coming years. Some highlights of this internship including getting to have A-STEM performed on me, as well as me observing it. A-STEM is a treatment therapy that uses instruments and cream to remove scar tissue or help to break up scar tissue and muscles in different areas of the body. So this can greatly help reduce pain and improve range of motion for a patient. One of the coolest tools that they had at Salina Regional was an anti-gravity treadmill. This is about a $26,000 treadmill, and I personally got to walk and run inside of it. And the cool thing about it is you basically feel like there's no gravity. You can adjust the treadmill to where you only feel about maybe 25% of your body weight, if not more. So the possibilities really are endless with that anti-gravity treadmill, especially for somebody who is coming off of a knee replacement or say an ACL tear. They are still able to walk and do pretty amazing things in this gravity treadmill that they wouldn't be able to do outside of it. I got to have dry needling performed on me as well as observed. This is another treatment therapy that uses acupuncture needles. These needles are injected directly into the muscle in these areas called myofascial trigger points, which are tender, painful spots on muscles that basically come from just tight muscle fiber bands. And when the needles are entered into it, it helps to release those bands and let them free up to reduce tension, relieve pain, and improve range of motion. Dry needling can be used in conjunction with electrical stimulation. Small electrical stimulation machines were placed onto the needles, which provided an electrical stimulation that caused the muscles to contract. I also got to sit in on evaluations. This was something that I'd never gotten to experience before, and I greatly, greatly enjoyed. I got to sit in on the first time visits for any patient with Denise, and this is where I learned the most. Watching Denise perform manual tests on patients, coming up with a general treatment plan on the first visit was super, super informational and important to me, which really, really helped my mind get more involved with the clinic and the atmosphere that was going on. During my time off, I got to hang out in the office with the physical therapist again and just ask any questions that I might have had. I also got to just play around with the different equipment in the room. With how big the gym was, they had so many different treatment modalities that were used for just about any injury you could think of. These are some pictures from Salina Regional Health Center. The first picture on your left shows the back corner with a couple treatment tables and other treatment kind of modalities that they use. The top right picture shows their main gym area with the parallel bars and the workout machines. The bottom right picture shows the rest of the gym, and in the very back is their machine row with a treadmill, an elliptical, an arm bike, recumbent bikes, and a step machine. And if you continued to follow that hallway, you would eventually end up where all their patient rooms were. There were 5 patient rooms where patients could have their evaluations done. While the internship at both places was great, I did run into some challenges. The biggest challenge that I faced was watching instead of doing. With my experience as an aide last summer, I really was expecting to get in and be able to work on patients as much as I did there. This was not the case. I was only a student observing, which meant I wasn't allowed to have my hands on the patients for most things. Now, from time to time, I was able to assist a patient with an exercise and stretch them out, but because I was not a paid employee, it was more reserved for observation. Another challenge was motivating patients. Being only a student there, sometimes I felt maybe a little bit out of place if I were to try and motivate a patient. There was sometimes a fine line that I didn't know where to cross between whether I should talk to this patient or whether I should just let them do the exercise. Another challenge was the sympathy versus empathy. I have been through physical therapy before, but a lot of the injuries that most of the patients I were with had not been through physical therapy before. So I was able to empathize a little bit on that level, but I could not sympathize with the exact injuries they were dealing with because I've never had a knee replacement like some patients did. The lessons that I learned through this were to be patient and take everything in at the current moment. My time will come to when I can work on patients, but for now, just being in the clinic and surrounded by PTs is a phenomenal opportunity for me. Keeping a smile on my face and having an encouraging and eager attitude was really, really helpful in me motivating patients because my eagerness allowed me to develop personal relationships with the patients in the short time that I was there, which allowed me to want to engage and talk with them. And then being willing to empathize and sympathize with patients was huge. While a lot of the injuries I couldn't specifically relate to, I was able to relate to the patients on the process of rehab and going through physical therapy. I never really surprised myself during the internship. I was thankfully noted by both the PTs that I worked with that the attitude that I brought on a daily basis was the exact attitude they want to see in a future physical therapist, which brought me great motivation. This internship greatly deepened my interest in physical therapy, and I can still see myself pursuing a career in it someday. I'm not certain on the specific setting that I want to be in, but I do want to work with athletes someday. Coming from an athletic background, working as a professional physical therapist for a sports team, for a college, would be a dream setting for me. I would like to thank my academic advisor, Professor Brian Minnick, for the opportunity to complete this internship between my junior and senior year of my undergrad. I would like to thank Peggy Minnick and Steve Sjogren for allowing me to observe at Salina Ortho, and a special thank you to all the other PTs and PTAs that I got to observe with. And I also want to give a warm, very special thank you to Denise Justice, who allowed me to shadow with her at Salina Regional, and another thank you to all the PTs and PTAs at Salina Regional that allowed me to shadow with them. Thank you.